Hello guys, today let's learn about antrochoanal polyp and ethmoidal polyp. Antrochoanal polyp is a single polyp from the antrum of maxillary sinus and ethmoidal polyp from ethmoidal sinus. So here only you can see that AC polyp is single whereas ethmoidal polyps are multiple and grape-like. So what actually polyp means? Polyp is benign, chronically inflamed edematous tissues prolapse into the nasal cavity. Okay. So this is chronically inflamed edematous tissues that prolapse into the nasal cavity. So we have two types, antrochoanal and ethmoidal polyps. Antrochoanal, it starts from the maxillary antrum and goes into the choana posteriorly. And ethmoidal, it rises from the ethmoidal air cells. First we'll see antrochoanal polyp. Okay. So suppose this is maxillary sinus. Okay. And this opens into the middle meatus. So from maxillary sinus or antrum, it opens into the nasal cavity, then it goes posteriorly towards the choana. Okay. So antral part is thin stalk, the nasal part is flat side to side, and in choana it will be round and globular. And if it grows too much, it can block the second nostril and can cause bilateral obstructions. So the origin is maxillary sinus near its accessory ostium. Extend from maxillary sinus, it goes into the nasal cavity and then directed posteriorly into the choana. And if it grows beyond choana, it will cause bilateral obstruction. It is usually single and unilateral, maybe bilateral if it grows beyond and blocks the other nose. Okay, so we have seen that it affects mostly younger individuals and predominant in males. The most common causes is Streptococcus pneumoniae or idiopathic also. So clinical features are nasal obstruction that we have seen, mucoid nasal discharge, difficulty in breathing, headache, hyposmia or anosmia because the air reaching the cribriform plate is reduced. So because of occlusion, there is hyposmia or anosmia. Hyponasal voice or rhinolalia clausa, so there will be nasal twang in the voice. There will be hampered ventilation to middle ear that will cause unilateral non-suppurative otitis media. You have to keep in mind non-suppurative, non-infective otitis media. So eustachian tube will be blocked leading to conductive hearing loss. So these are the clinical features. On examination, polyp is visible on anterior rhinoscopy, and in posterior rhinoscopy it is grayish white mass. Okay, done to access and confirm the diagnosis. So what are the DDs in children and young adults? So the DD can be meningocele, okay, meningoencephalocele. So before surgery, we have to perform the aspiration from this and see if CSF is there. If CSF is there, it means it is meningocele. In juvenile or adolescent phase, the DD can be GNA, okay, and in older individuals, it can be malignancies, okay. So diagnosis, we have to do X-ray. It is good in sensitivity, and we have to do lateral view of head and neck. So here we'll see the crescent and dot signs. Column of air present between the mass and posterior pharyngeal wall. Okay, so this is dot sign, and this is absent in malignancy and GNA. Okay, GNA we have to keep in mind because it is red and vascular, highly vascular, and it undergoes profuse bleeding. So we have to be very cautious while dealing with GNA. Then after X-ray, we can go for non-contrastivity of nose and paranasal sinus. The treatment, there is no role of medical therapy, so we have to directly go for FES, that is functional endoscopic sinus surgery, and only diseased tissues are removed with help of endoscope. Before surgery, we have to palpate the mass, check if it bleeds on touch, means you have to rule out the juvenile nasopharyngeal angiofibroma, okay, and aspirate to check if it is meningocele or other things. So this was about the antrochoanal polyp. Now we'll see about the ethmoidal polyps. So it occurs from the ethmoidal air cells, and it looks like a bunch of grape appearance that we have seen in the first things only starting. Extend from the ethmoidal air cells and directed anteriorly. So you have to keep in mind it directed anteriorly. Age group in adults and middle-aged. Causes are allergy and ciliary motility is lost, mainly systemic cause, and it is usually bilateral, multiple and bilateral. So you have to keep in mind ethmoidal polyps are bilateral and multiple. Associated syndromes are chronic rhinosinusitis, okay, in both allergic and non-allergic origin. Asthma, cystic fibrosis, cardiogenic syndromes, bronchiectasis, sinusitis, situs inversus, and ciliary dyskinesis. So in cardiogenic syndrome, you can see all these things. Young syndrome, here you can see sinopulmonary syndrome and azoospermia. Churg-Strauss syndrome, here it is accompanied by asthma, fever, eosinophilia, vasculitis, and granuloma. So these are the systemic causes for the ethmoidal polyps. Let's see a triad that is associated with ethmoidal polyp. So that is called Samtos triad. Samtos triad you can remember as BAN. So we have bronchial asthma, A for aspirin sensitivity, and N for nasal polyps, mainly ethmoidal polyps. So avoid aspirin in patients with this ethmoidal polyps. Symptoms of ethmoidal polyps are bilateral nasal obstruction because it is bilateral and multiple, difficulty in breathing, nasal discharge, bilateral nasal intonation of voice. So bilateral nasal intonation in voice, that is rhinolalia clausa, bilateral hyposmia, eustachian tube block, that is also bilateral, excessive sneezing, anosmia, snoring, headache, bilateral ear discharge. So these are the symptoms of ethmoidal polyps. On examination, only anterior rhinoscope is sufficient to diagnose. There is multiple sessile pedunculated mass resembling bunch of grapes. So these are hallmarks. It is insensitive to touch and there is no significant bleeding. Diagnosis is based on X-ray. Non-contrast CT is more sensitive and specific and is the investigation of choice. So non-contrast CT scan can be done. Here, because it is due to allergy mostly, so we have to look for elevated serum Ig levels. Saccharin test in nasal ciliary modulated disorders. Elevated nasal NO means nitric oxide measurement in ciliary modulated disorders. Elevated sweat chloride test for cystic fibrosis. Okay. So these tests are done in ethmoidal polyps. Ig, saccharin, elevated nasal nitric oxide measurement, sweat chloride test. On electron microscopy, you can see increased transepithelial potential difference when cystic fibrosis is suspected. And then you can go for gene and DNA analysis. So the treatment for ethmoidal polyps, because it is due to allergy, we can give antihistamines, steroids, systemic and topical, that is intranasal, and nasal decongestants. After medical therapy, reevaluate the patient, that if the polyp is shrinking in size and disappearing or not. And the final or surgery is FES surgery, that is functional endoscopic sinus surgery. So this was about the ethmoidal sinus. So let's quickly see the differences between antrochoanal polyp and ethmoidal polyps. Antrochoanal polyp is seen in young, whereas ethmoidal polyp in adults. It is due to infections and it is due to allergy. Antrochoanal polyp is usually single, but ethmoidal polyp are multiple. Antrochoanal polyp are usually unilateral, but it can be bilateral. Here origin is maxillary sinus, here it is ethmoidal sinus. It grows posteriorly, and ethmoidal sinus or ethmoidal polyps goes anteriorly. There is no treatment, no medical treatment as such for antrochoanal polyp, but ethmoidal polyp we can go with the antihistamines and steroids. The final surgery is FES in both cases. The recurrence chances of AC polyps is less and EP polyps are high. So this was about the difference between antrochoanal polyp and ethmoidal polyp. So you can here see it is single, here is multiple grape-like, here it grows posteriorly, it grows anteriorly, and it is seen only in young and it is in the adults. So these are the differences between the antrochoanal polyp and ethmoidal polyp. Thank you so much.